All right. Dhini is our next presenter, and she's founder of ParaDocs Health. Please come. Please welcome Dhini.
Hello. My name is Dhini, or Dhini. You can call me Dhini. So, just a bit briefly about myself. So, I'm a medical doctor, primary care, born and raised in Indonesia. Have an autistic cousin. Help him get through how to, treat the autism and whatnot. And then it's from the autism, it leads me to neuroscience. I work in Singapore, Malaysia, and then back to Indonesia, and then spent time in Munich as well to learn more about neuroscience and regenerative medicine. So back and forth like crazy. I'm a lunatic that way. Never stays in one place more than 2 years. So Indonesia, Singapore, Malaysia, Munich, and then one day someone at Babylon Health, which is it's a huge unicorn digital health company based in London. They reached out to me like, hey, Dhini, do you want to be one of our clinical ad researcher? So that was actually the tipping point where I decided like, you know what, I don't want to practice medicine anymore. I want to do this again and again. So launched the product with Babylon Health. It was really moving, and then got an offer to join the Texas Medical Center in Houston back in 2022. And so here I am. So what is ParaDocs? So the title it says here, like I'm designing a domain expertise AI that we empower therapists before the doctor sees it. So ParaDocs is an intelligent platform for complex chronic care. We help the caregiver manage patients in skilled nursing facility and long-term care. And the reason why we believe why we do it right now, because of course I think everyone will agree with me here, like the aging populations, it's really rising, the burden in the healthcare is like 4.3 trillion, I think last year, and 25% of that is actually goes to the admin stuff, like because getting the data, reporting it, aggregating it. So we have so many massive data, but no one can actually make sense of it. Hence, I would quote my customers, all the users always say to me, every day it feels like the blind leading the blind. So when the patients got discharged from the hospitals, they would get admitted to skilled nursing facility. The primary care had no idea about these patients. And so usually they would get the information in up to 3 months. So like, can you imagine like, what are you gonna do with that patient? You do nothing about this patient. So the patient will go in and out the hospitals, and the cost goes really, really high. So we find out like one of the insights we learned with what is the problem with fragmented data is that not one the data is everywhere. You have the HIE, you have the urgent care, you have the ambulatory, you have the hospital, specialty. Usually elderly people would have like 5 specialty, which means 5 EMR. It's all over the place. And then you have data from the health insurance as well. It's not that it's inaccurate. The problem is it's very delayed. By the time the primary care get the data, the condition is just not that anymore. So it's useless. Like, it's been done. So we create a platform that actually, it's real time, it's dynamic. So we aggregate multiple sources of data. So we're able to get surfacing the information that actually matters, so that it's very quickly for the doctors to take action on. So we interviewed hundreds of stakeholders that use a lot of vendors to solve the data for them. Because I keep hearing the same thing over and over again. It's inaccurate, it's not reliable, and they still have to spend like half an hour to 45 minutes to actually get the right information. So we built a platform that sits on top of the EMR that actually shows just what matters, that heavy on the clinical context. So we call it an evidence bundle. So our AI will suggest like, hey, it looks like there's a trending of GFR in this patient. this is the evidence, and do you agree or not agree with it? So the care team will approve, deny, or edit. That's how our AI is going to keep learning, and then they will relay it back to the providers, so the providers can actually take actions. So far we've been around for 3 years now. At first, of course, like I'm sure there's a lot of founders here have learned, getting the product market fit is so difficult in healthcare, because my background is a primary care. So at first we were kind of like, let's help the small size clinic, expand their clinic, because they were struggling. A lot of them went bankrupt because they operate at a really tiny little margin. But we learned that getting them on board, it's so long, it's so painful, and the revenue that we can actually generate is just not worth it, because they don't have the resources to actually implement some tech solution. So learning that, we decided like, well, let's go to the enterprise level, that the populations range like more than 20,000 patients, where the pain point is so visible. And it's a really soul-sucking job for the care team to actually switch between like 8, 12 portals every day, the Excel sheets, and switching the tabs in the EMR is so painful. So hence since 2024, we're focusing on skilled nursing facility and long-term care that manage multiple facilities, like thousands of patients. So we so far successfully get over 1 million longitudinal records, and we just like a month ago we did a 12-month pilot with one of our first major customers, and we actually projecting 5.2 annual revenue for them, and of course 99% reduction in manual charting. And what does it mean for patients? I know we all care about patients. So of course, for the patient, it's like our intelligent platform basically helps providers to execute managing chronic condition faster and better. That's what it means. So like we make sure nothing slips through the crack. Like if there's any suspect conditions, or like the big goal in the next 2-3 years, we want the domain expertise should be able to predict acute events before it's actually happening. So that's what we want. Like we want to be proactive and prevent acute events to actually happen for our elderly patients. So this is the team. It's me and my co-founder. He's the CTO, and we are supported by really brilliant people that really believe in the mission, and they do understand. It's startup, so everyone's like on board to just kind of like learn the problem and iterate again and again and again. And yeah, that's it. Thank you.
Any questions?
How do clinicians use the insights? How do they engage the platform to help their patient care?
So the user is the care team. So the care team will be the one that approve the suggestion. So when they hit approve, it will be pushed back into the EMR. So the doctors will see the suggestion already approved by the care team.
Any other questions?
Hi, I'm Holly Say. I'm a primary care physician, internist as well, and a solopreneur. So I was just wondering about like an actual real world example. Like you talked about care gaps. Immediately my mind went to all the things we have to report on by the end of the year to prove that we're giving good care. A hot one these days is GFR for kidney function. Let's just say, totally taking that as an example. I can imagine that maybe one of your patients goes to an ER on a different system. They draw a basic metabolic profile. It has a GFR on it, but the home system responsible for the care of that patient doesn't have access to that GFR. Is that the kind of thing that your platform pulls together, and does it make it available to the doctor in the SNF or the assisted living location for them to know about? Like how does it all come together for action at the point of care?
So see, point of care is really like a huge problem, because we learned that every provider point of care is somewhat different. right? So some say point of care, which means like exactly the moment when you see the patients. But we learn, like especially at State and LTC, one of the reasons why we go with them, first is like the most sick patient, and second is there's no issue of patient engagement. So it's all been scheduled beforehand to visit. So we know when the doctor's going to visit those patients. So yeah, before the doctors actually go to the state of the LTC, all the information is already there. So we pull it from multiple sources, whatever they have. So it depends on the state. Some have HIE, some doesn't have any HIE. It's just like, it's really disgusting problem, to be honest. But yeah, so, and you'll be surprised how much hidden information is actually buried in the EMR itself. It's actually there. It's just not where you would expect it to be, because every provider has his own style on coding stuff. So that's what we're training our we call it ParaDocs, to like find those value and link it into like, it looks like this doctor is trying to say this, but there's nothing document. So that's what we're surfacing, and then the CAP team will like agree or not agree, and then it's up to you, like, if, you know, to kind of like take action on it, the doctors at the point of care. Am I answering your question?
Yeah, so it's kind of like chart prep, so that when the doctor goes out there to see
Yes.
the patients, all of that information is kind of streamlined and prepped and found.
Yes.
Okay, got it. Yeah, thank you.
Thank you very much.